Hello, everyone. I'm Eric Glad with Outlaw Partners, and welcome you to another afternoon of the Big Sky Virtual Town Hall. Grateful for your time this afternoon and look forward to having a great, robust conversation the next 90 minutes. That theme music, that's our advanced production of becoming a little bit more of a live TV show, I guess you would say, on Zoom. But that was inspired by a podcast I was listening to today. There is an ER in the Bronx that every afternoon they blast that song, Don't Stop Believin', to inspire all their workers to keep after it. And it's become a really nice centering point for the ER there. And we thought it'd be appropriate to help share that and know that we not only support them, but for all of us to don't stop believing. It's been 8 weeks now, and here we go. Another chapter is being written. I'm joined today by Joe O'Connor to bring you another episode of this Big Sky Virtual Town Hall. As this platform has gained momentum and the tens of thousands of viewers, we have understood and embraced the importance of words like community, communication, and perspective, all of which we will cover today. Today we have another amazing panel, some of the most respected, talented, and inspiring people out there, and we're grateful to have them here today. A quick special thanks to our sponsors, L&K Real Estate, as well as Generation Jets. Grateful for both of them joining us and helping underwrite this platform to speak to you. So our panel today, wow, do we have another amazing lineup. We've got Senator Tester joining us today. Always fun to talk to the amazing senator out of Montana, so grateful for his time. We've got returning guest from the Gallatin County Health Department, Mr. Matt Kelley. This guy's probably done more press conferences or Zoom calls than anyone in the county, so we're grateful to have him back to talk a little bit about what he's seeing on his front. Also, another returning guest from the Big Sky Medical Center, we've got Taylor Rose, and he'll be able to address some updated questions that we're seeing on the medical front with the medical center. They've been awesome for our community, and look forward to having him back to kind of hear a look back over the last 8 weeks and understand where we're headed in the next couple weeks and months. And then we're bringing it local. We've got some all-star business owners. Carrie Blodget from the Rocks. We're going to have a nice conversation with her, what it's like to be opening a restaurant back up and being in the Big Sky Town Center, what it's like to be operating a small business like that. And then we're going to close it out with some long-time locals. If you've been around Big Sky for a while, you've definitely heard of the Fabozzis. Kevin and Carrie Fabozzi, the owners of the Consignment cabin. We're going to have a nice conversation with them. And if we're lucky enough, maybe we could talk Kevin into picking up his guitar and playing us a song. So that's what we got today. So let's jump over and welcome the Senator. Senator Tester, do we have you online here? Well, I think we've got a little technical difficulty. So what we're going to do is audible here, and I'm going to turn it over to Joe. And Joe's going to be talking to Matt Kelley with the Gallatin County Health Department. Joe, take it away.
Yeah, thanks, Eric. We are lucky to have Matt Kelley with us, health officer for Gallatin City County Health Department. Matt, welcome. You've been on the run, keeping up with a rapidly changing pandemic. How are you holding up?
We're doing well. It's day by day. You know, it's been a difficult 2-3 months for everybody, but we have a great team. You know, when we had a lot of cases and active cases earlier this spring, that was a cause of great concern. But I think what I kept harping on and what I kept trying to reinforce is that a lot of the strength that comes from having a diverse, economically strong county. There's a lot, while it brings people in, we might have more cases because of it. There's a lot of strength in it too. So we're doing great.
Oh, that's good to hear. You guys are doing a fantastic job. You know, among many other things, you all have been working, long hours with West Yellowstone National Park, the governor's office, the state health department, about the importance of if and when Yellowstone National Park will reopen. Can you update us on some of those conversations?
Well, there's active ongoing conversations between Cam Shawley, the superintendent of Yellowstone. He's working with the governor's office in Montana, the governor's office in Wyoming, and he's been really great. We're reaching out to the health officers of the 4 counties that are contiguous to Yellowstone. So Park County, Montana, Gallatin County, Montana, Park County, Wyoming, and Teton County, Wyoming. And as you can imagine, that's really complex. He's got 2 states, 4 counties. They're really trying to figure out a way to reopen it safely. I think we're moving toward that. I think each county has its own concerns. Certainly, we've had more cases. West Yellowstone is a unique situation because it's such a small community, and the potential for overwhelming the healthcare resources there are pretty great. So we're working really 2 tracks there. One, with the park to put in place some things that will allow us to reopen safely. But then we're also working with the town of West Yellowstone and Bozeman Health, community health partners and others to increase the capacity of the healthcare services in West, the testing services in West, so we can do it safely as well. There's no date certain. There's been a lot of things thrown around. I don't have anything, I can't break any news there, but I can tell you that everyone's kind of working together to find a way that we can reopen. There's public health risk involved in that. But as I've said, there's risk involved in not opening as well. So we're trying to balance those things.
Well, that's a huge undertaking, and we can certainly, appreciate the effort you guys are making there. You were talking about West Yellowstone. There have been now 3 new cases in West Yellowstone in the last week. Does this throw off or delay any second phase of the governor's plan?
Not those cases in particular. I mean, having 2 or 3 cases, we know we're going to get cases on an ongoing basis, probably for the rest of the year. What we'd be most concerned about is if we were seeing a regular increase of cases, we were seeing cases day after day, and we were seeing evidence of something that we call community transmission, where we're seeing evidence that the disease is being passed from one person to the next in a really substantial way. I don't think we're seeing that right now. We do have 3 cases, but we're working really closely with folks in West Yellowstone and the family that's been impacted. So it's not going to upset the apple cart just because we have 2 or 3 cases.
Yeah, gotcha. Another thing you guys have been working on, the health board this coming Wednesday has a meeting to discuss Governor Bullock's phase 1 reopening plan as it relates to certain entities, among them gyms, museums, theaters. What can you share with us about the potential reopening of these entities?
Well, Governor Bullock last week went to what they're calling kind of phase 1.5. So it really would allow those types of facilities you've talked about, gyms, theaters, those kinds of places to some kinds of theaters to reopen in a limited way. What we have in Gallatin County also is a local Board of Health rule. The Gallatin City County Board of Health, when the governor came through with his directives on reopening, really decided that they were going to support that reopening, and they created a local emergency rule. The board is going to meet early on Wednesday morning, and they're going to consider whether to alter that rule to, again, be consistent with where the governor is. The local boards of health have significant local authority to make those decisions. They can be more stringent, they can't be less stringent. So they could decide to become more stringent and slow down. But so far, the board has decided to go along with where the governor is. And I think that they'll probably pay real close attention. I'm not going to say what the board will and won't do. But in the past, leading into this, we've really followed the governor's lead and tried to make that reopening guidance work.
Mm-hmm. And that is a May 15th. Is that the governor's directive at this point for those?
Yeah, I think Friday.
Yeah, Friday. Gotcha.
So we're trying to get that done. We're trying to get that done in advance of Friday. That's why we're having a meeting on Wednesday morning.
Gotcha. Last one I got for you right now. So say my family is visiting in early August. What should I tell them? Should they cancel or should they come?
You want me to go to August? Huh?
Yeah, let's go to August.
I think I would continue to watch what's happening with the number of cases we have, with the level of disease transmission we have in the community. Continue to watch the guidance that's in the directives. And no matter what, as we move through this, we're not going to get to a point in time this summer where we're going to say we're done. We can stop worrying about this virus. People are still going to have to take precautions, still going to have to be careful, especially if you're somebody with an underlying health condition. If you're somebody who has pulmonary problems or diabetes or even high blood pressure, those are things that put you more at risk if you are exposed to the virus. Our hope is that as we move through the summer, we can keep the number of cases to a manageable level as we've been able to do so far with the reopening. And that as we move through the summer, we can really enter the fall in good shape. That's my main goal, is that when we get into the fall and the winter, we're not already digging ourselves out and trying to play catch up with a bunch of new cases, because we know in the fall and the winter, we're likely to get influenza come back. And we're also, there's some expectation that we're going to see some degree of resurgence of COVID-19. And so those two things coming together create really significant challenges. And we want to make sure that we're managing our summer so that we go into the fall and the winter in pretty good shape. So people who are considering a visit, I would say in August, I would say continue to watch what's happening here and our success in Montana and in Gallatin County, sort of continuing the trend that we have right now.
Yeah, for sure. And that was something I was going to ask you. You know, there's certainly been talk of a potential resurgence of COVID-19 toward, you know, the fall, early winter. Any insight as to probability of that? Just curious what your thoughts are.
No, this is a new virus. I think, Dr. Fauci has said there's no doubt we're going to see cases, and we're going to see a rise in cases as the weather. We don't know whether that'll be a slow rise or a spike. We don't know if that'll be localized or national. We don't know if it'll be worldwide, for that matter. There's so much we don't know about this virus. There's so much we don't know about spread. I'd remind everybody that this virus we've only known it as a human, within the human body for about 5 months now. So there's just a lot we don't know about immunity. We're just going to have to kind of walk through it together and see what happens.
Yeah, absolutely. Well, look, Matt, thank you so much. I know you guys have a lot going on. You're in meetings constantly. You've probably had enough Zoom meetings to last you a lifetime, but just curious if there's anything else, you'd like to add, anything additional that you guys are working on you'd like to share with our viewers.
I think just generally Montana has had some success because we acted early and because we acted in a unified way in reducing the number of cases and we think reducing the amount of disease in the community. I think it's important, though, as we move forward, to continue to look at what's happening to our neighbors, what's happening in the Dakotas, what's happening in Iowa, what's happening in Utah, what's happening as far away as New York and New Orleans, to kind of keep in mind that the virus is still out there. It's the same virus. It's a dangerous virus. And that while we've had some success, that's really because we've all been careful. And so I would urge people to continue to be careful. That even as the regulations change, we can get together in groups of 10. I would urge people to really manage how many groups they're in. If you have 10 groups of 10, that's still 100 people, and you're still at risk from everybody that you're in contact with, and you're putting everybody you're in contact with at risk. So really manage those things. It's difficult. I'm looking forward to a year from now when we really know a lot more about this virus, potentially to have a vaccine. But our focus now is on continuing this trend of the summer and moving into the fall and winter in a way that we can continue the success.
Right, absolutely. Well, look, Matt, thank you so much, for your time, for the work you guys are doing. It's imperative to the community, and as we all move forward, we'll continue to be in touch, and appreciate your time today.
Yeah, I see Senator Testers has joined you now, so I'll let you go.
Thanks so much, Matt. Take care.
Take care.
Eric?
Absolutely. This man doesn't need much of an introduction. He's hails from Havre, Montana. He's a dedicated farmer, amazing steward to not only a public servant to Montana, but also to our country. And a little known fact, he's also an amazing Pearl Jam fan. Senator, welcome today. Thank you for joining us.
Thank you. It's great to be here. I appreciate all the words that Matt had to say. I think that level of common sense there speaks well, and I very much appreciate what he had to say in regards to the virus and the economy and all that stuff.
Well, absolutely. Matt's done a great job for our county and our state. I guess to kick it off with, Senator, you've got such amazing perspective and obviously ties around the country. What grade would you give Montana for our recovery efforts so far? How do you think we're faring?
Well, I used to be a teacher. I graded pretty tough in those music classes. I can't think of much that Montana, particularly the governor, has done wrong so far. I mean, he came out early, as Matt said, and he put down some stuff that at the time I thought, wow, closing schools. When he closed schools, I thought, holy mackerel. But the truth is, in retrospect, he did it right. And I think his opening of the economy has been done correctly too. All this stuff is so up for change, but the truth is, I think that he's been very measured in opening up in an appropriate manner. And I think so far so good. I do think that, we got to continue to monitor, got to continue to listen to the healthcare professionals out there to make sure that this thing doesn't change rapidly and overwhelm the system, because I think that still could happen. But so far so good. I think the economy's opened up pretty well in Montana. I don't think it's that way all over the country, and for good reason. But from a Montana perspective, I think things are progressing in the appropriate manner. And I think the governor's had his finger on the pulse and done a pretty darn good job.
No, absolutely. Well, I hear that a lot. And so I think that hopefully we'll continue that trend. Senator, what's something, as we shift into this next stage, what's something that you're hopeful for?
I'm hopeful we get enough tests. I mean, I think that's the thing that's really frustrating about this. I mean, and I'll just tell you the way I see it. I mean, I heard the president again say today, if you want a test, you can get a test. There's no problem. I can't get a test. I mean, I called the physician here in the Capitol and said, you know what? I've got to go home, and I've got a farm, and I've got stuff I have to do. My son's living with it. He's an asthmatic. I'd love to get a test on Wednesday or Thursday to make sure that I'm not bringing coronavirus back into our house. And they said, look, unless you've got symptoms or unless you're exposed to a known coronavirus person that's been infected, you can't get a test. And look, I mean, I don't want to test because I want to test. I want to test to keep people safe. I think that's the same thing with the economy. I think if we get enough tests out there, I think the economy opens up much quicker. I think take the park for an example. At some moment in time, the park is going to open up, and how they do it and how it's been done is going to be a real feat. But if they had tests so that anybody that had a fever or anybody that thought that they had coronavirus could get tested, man, oh man, that makes such a big difference on not only determining if it's safe, but also tracking, because you're going to have people from all walks of life walk into the parks all over the country. And so I think tests are where it's at right now. There's work being done on a vaccine, of course, but tests are really critical. People like me or any public policy person can say, the economy's opened up, but unless people feel like it's safe for them to go out, especially if they're over the age of 65 or even 60, they're not going to do it unless they think it's safe. And so that's what's really important here is tests, in my book.
Yeah, absolutely. On the recovery side of it, what same question. I mean, what are you hopeful for on the recovery side, or how would you talk about, how your feelings are with that so far as we've started to slowly turn the lights back on per se and step back out there?
Well, first of all, my heart goes out, especially to the folks that have the bars and the restaurants that are in the hospitality business. They're the folks, that are running the buses, that all that stuff. They just got hammered on this stuff. So I'm hoping that what's been going on right now works, and I'm hoping that the distancing that the bars and the restaurants are using works so that they can stay open and keep going. I don't think we will be back to normal. And this isn't a big secret until we get a vaccine and not to beat tests up again, but tests would help with that opening. I see, I see things moving in the right way. Look, I flew back here a week ago today. The plane was half full. I flew back here today. I would say it was 2/3 full. I mean, to the point where I was feeling Like I couldn't get the social distancing on that plane because it was only a 50 passenger plane. I bet there was 35 people on it in the front row, not having anybody in it. It, you know, it was the fullest flight I've seen in over 2 months.
Right.
So I think things are starting to move. I think that being cautious is something that people need to continue to do. I mean, I think you can still have an economy that opens up and still be smart about it. You know, if I need to go in and buy a battery from my wholesaler to put in my car, I don't want to be hugging the guy that's selling me the battery. You know, let him set the battery out, make the space, you know, hand the credit card, wash your hands, do all that stuff. And I think the economy will move forward much quicker if that's the case, because we'll be using our head. But make no mistake about it, as policymakers or as business people or as government officials, however you want to classify yourself, work in public, Mother Nature always bats last on this deal. The virus is going to do what the virus is going to do. We just need to try to adapt to keep ourselves safe. But I think in Montana, it's a different story back here in DC. I mean, there's nothing open back here. And if you walk into a grocery store, you'll play hell getting within 10 feet of anybody back here, because man, I'll tell you what, I've never seen anything like it like last week. I mean, they respect the social distancing stuff to the max. And like you'll be in line to check out, you look behind you and hell, the next person's 10 or 15 feet behind you. And that's just the way it is all the way down the line.
Wow.
So, but you know, it's a petri dish back here compared to Montana.
Right.
But the truth is we still need to know that it can affect rural America. So I think the economy is going to open, and it'll continue to open and do good things as long as people respect the virus. Let's just put it that way.
No, respect is a good word. And, you know, Senator, I share a first person story, and we work with a lot of businesses here in Big Sky, and a lot of what you'd see around the state that you know so well is businesses, you know, under 50 people. We were amazed that PPP money showed up. I will tell you that I bet friends that I never thought that check would arrive, and it showed up, and I'm extremely grateful for it. And it's allowed us to go out. But I think the one challenge that we had was it didn't allow us to budget. Like a lot of people used to taking money and budgeting it. You know, we're forced to spend the money a certain way, and it's great. It's allowed our employees to be propped up. But here's the question. After these 8 weeks end, a lot of people are starting to get really worried that that's when we're going to see that cliff edge. So I guess what advice would you have for businesses that did get that money, and you know, let's talk about week 9.
So, I mean, I think as with any business, you have to plan. You have to look at the landscape, and you have to plan to try to meet that landscape. And I think you're going to be nervous. I mean, I'm nervous, and I'm not in as high a risk of business as the bars and the restaurants and the motels and those kind of folks are. But you look at your landscape, and you determine how you're going to move forward, assuming that business is going to open, but probably not to the bore it was last year at this time, or last year in June or July. And then I would say, if it looks like there's not going to be enough money there to keep the wolves away from the door, and you do have the prospects of maintaining that business moving forward, because let's just be honest, there's going to be some businesses that are not going to survive this. That's very unfortunate, but it is a fact. Just like there's going to be some people that aren't going to survive this, and it's a fact. But the truth is look at the landscape, and if there are programs, idle programs, a prime example, it's a loan program, it's a low interest loan program that businesses use, and it works pretty effectively through HUD. And I think that if that's a program that can work, then we can take a look at possibly plussing some of them up moving forward. If not through a package, which I don't know that there is going to be another package, but you know, we're going to be working on next year's appropriations, and it's coming right up at the end of September. And so there's ways we can plus that up going forward too. But you got to communicate, make sure you call my offices, call me, get a hold of everybody, and I'd get a hold of the whole delegation. I'd get a hold of the governor's office too, and say, this is what we see coming down the road. This is the valley of death that we're worried about now, and are there things that you can do to help us even that out moving forward.
Okay, well, good advice. Switching gears, I mean, there's obviously a lot of other things you're passionate about and working on. The world can't stop with COVID. You know, so what are some other bills or things that you'd like to share the audience with that you're passionate with? And I know that a lot of people are really curious on what impact COVID's potentially had on the Great American National Outdoors Act. That's really a big deal for us down here with the parks and a lot of that,
Yeah.
you know, the Land Water Conservation Fund. So any updates there?
Well, I'll just on the park dollars and the land and water conservation full funding and permanent funding, that's all been kind of put on the back burner. There's been some push to put it on another COVID package that comes through. I don't know if there's going to be another COVID package. One of the things that's frustrating about, and there could be, and if there is, we'll push to try to get it on. But one of the things that is frustrating about the United States Senate is that there's a lot of good bipartisan bills out there that we don't get a chance to take the floor and debate and then vote. If it goes down with a vote, it goes down. If it passes, it passes. Instead, we sit around here and literally don't do much but vote on nominees, and it drives me up a wall. So we could take that great outdoors package and put it to the Senate floor or get it to committee and get it out. We're doing that stuff. A lot of these committees we're doing virtually now, so there's no problem. And get it to the floor, have the debate. You know, we never debate when there's more than one person on the floor anyway, so this all fits into the role of the Senate, and try to get that out, and it can happen. But it's kind of on the back burner right now because everything's COVID all the time. I'll tell you a couple things that I'm working on. I've got a mental health bill that I'm working for veterans that I think can help the VA deal with an issue that has been a plague for them for the last, 15, 20 years, and that's a veteran every hour taking their life in this country. And make no mistake about it, if we can get this stuff done, get this bill done so the VA has the tools. It's stuff thinking outside the box stuff, you know, equine therapy, yoga, you name it. There's a lot of stuff out there that just is better for a lot of people than sitting on a couch and talking to somebody. But if we can get that done, there's some grants in it to help. I think that will not only help the VA, but we've got a mental health issue in this country and a suicide issue. We know that in Montana as we lead the nation in suicide, or at least did last year. Hopefully we don't get that again this year, and we can help with the general population too, if we can find the right formula here. So that mental health bill, which will be the piece that comes out of Congress this year, if we can get it passed, by the way, and it passed the Senate Veterans Affairs Committee 19-0. The most conservative and the most liberal person on that committee both voted for it. So it tells you the kind of thrust it has. That can be very positive. I'm also, you've heard a lot, this is sort of COVID related actually, but it's been going on for 15 years. And that is what's going on in the beef industry and the packers and the consolidation in the beef industry, and how that's putting small and medium feeders out of business. We've seen the price of beef bump up a little bit, but my God, it's been in the sewer. A lot of it's because of all the trade stuff that's gone on over the last 2-3 years. But COVID and the packing plants closing down have also multiplied on the negative impacts on cow-calf operators and small and medium-sized feeders. So we've done a couple things. I've asked the Attorney General to do an investigation in the packer industry to find out if there's any collusion and if the laws that we have on the books are working. I don't think Attorney General Barr is going to do that. If he has, he certainly hasn't got back to me and told me he is going to do it. And by the way, it wasn't just me. There were many, many senators that signed on to multiple letters asking Barr to do that. So I've started drafting bills. I've got 5 of them that are going to basically attach the price of box beef to the price that they're getting in the feedlot, so that it's a regulation. And I'm not crazy about regulation myself, but if capitalism isn't working, you have to do something about that. And if we lose these small and medium-sized feeders because they're losing $300, $400, $500 a head, and they're making over $2,000 a head, that's not fair. And so we've got to do something about that. So I've got a number of bills that we're working on right now, knowing full well that these are going to be hard to get across the line because the packers like it this way, and they've got, in my opinion at least, they've got the market pretty well sewed up. And so to hell with everybody else, they're going to make their money. And if the other guys go broke, they go broke. But I think it has some major impacts, not only on the cattle industry and the hog industry, but it also has an impact, major impact on the consumers and the cost of protein. So we're working on those things right now. We're also working on some broadband issues for rural America. Hopefully getting it so we can get some money out the door to lay some broadband, which by the way existed before COVID, but COVID has really brought this to the attention, especially when we're doing telehealth and teleeducation. And so it just really showed where the digital divide is and how we need to make more of an investment if we're going to keep rural America in the 21st century.
Well, thank you. All those that's a mouthful, and that's a lot of work. So thank you for that. And last question I have for you, Senator, and then I'll turn over to my colleague, Joe. He's got one or two questions from the audience, and I always love to ask people that are serving our country and our nation. This question is, what's something that you're grateful for?
Well, this is still the greatest country in the world, and I'm grateful for the ability of people to be able to speak up, even though sometimes I look at the TV and I question why they're doing what they're doing, but by the same token, they have every right to do it, and I'm thankful for that. I'm thankful that I live in Montana. I'm going to tell you that all you have to do is live in a city, and I've never been a city person anyway, but I will tell you that Washington, D.C. is probably as good a town as there is in the country. But damn, I'm going to tell you what, I'm so happy. I live in Montana, and my wife there, and our farms there. I mean, my folks chose right. What can I say? And my grandparents chose right.
Right.
And I just am very, very thankful for that. I got to tell you something. If I didn't have to come back to Washington, D.C., I could self-isolate pretty damn easily, because you're pretty much self-isolated on the farm by default.
Oh, absolutely. Well, we'll look forward to seeing you back on the landscape here soon, Senator. I'll throw it over for one or two more questions. Grateful for your time today. Joe, do you have one or two questions from the audience?
Yeah, I do. Thanks, Eric, and thanks, Senator Tester, for being here. You know, I think the last time you and I saw each other, I was on your ranch, and we had a good interview there. But
I still got the hats, man. Still got those hats.
Oh, good. Yeah, that was a great time. You know, you mentioned your recent plane rides. Congress is back in session, and you flew back to D.C. on May 4th. You were trying to get there for a 5:30 vote for the nomination.
And again today.
Yeah.
And again today. Yeah. Go ahead.
And again,
Go ahead, Joe.
and again today. Right. Well, that first one, you know, that was an eventful trip. It began in Montana at 1:30 in the morning and ended in D.C. 15 hours later. That sounds like it must have been a new experience for you.
Well, it is and it isn't. I mean, typically before COVID, the plane would take off in Great Falls at 6 in the morning and get into DC at about 1:45, 2 o'clock in the afternoon. So I would get up at 3 in the morning to get to the airport by 5 to take that 6 a.m. flight out. And since I still farm and since you still need to get around the state, pre-COVID days, I did that virtually every weekend. I mean, literally a handful of days, I'd miss those and stay here on a weekend. But the flight a week ago on Monday was a little different, because I had to get up at 1, get on the road by 1:30, and you know, you give yourself an hour before the flight takes off, but then I give myself another hour in case you got a flat tire, because I had to drive 4.5 hours, and I had to swap out, get a rental car, make sure all that stuff works. You just have to allow some extra time. And then I got there, and thank God I can sleep on a plane, because I got to Missoula and jumped on that United flight, and the lady said that was the busiest flight. It was half full. It was the busiest flight they had in 2 months, which was a good sign. And then we took off and went into Denver. And you know, a guy gets kind of rummy when you don't get much sleep, and I didn't get much sleep that night. And it's kind of funny, because I think I landed at C Concourse in Denver, if you guys are familiar with that airport, and the C-25 we were taking off for DCA, for DC Airport, and I look up and it's got Sacramento. I go, geez, Sacramento. This flight hasn't taken off yet, and I'm wandering around. There's not that many people in the airport anyway, and I look, and hell, I got to go out of B Concourse, so I'm just lucky I just didn't dope off and miss my flight. So I jumped on the train, got to B, and B-25, sure enough, DCA was up on the board so I could make the flight. But it's one of those things. It's part of the job, flying back and forth to Montana. I told you how grateful I was for living in Montana. You know, the negative thing living in Montana is you got to want to get there from DC and get to DC from Montana. So it takes you some time to do it. But it's cool. It's good. You know, the airlines for the most part they do a good job. I'm a little frustrated today because they're running a 50 passenger plane and picking up people in Great Falls and then stopping in Helena and picking up people, which is fine. But hell, why not run some of those 75 passengers that are grounded so people can distance themselves on those planes a little better? I don't get it, but it is the way it is. I'm sure they've got their challenges too.
Sure. Well, you know, I remember when I interviewed you rather a few years ago at your ranch, you talked about one of the biggest differences about being in DC as opposed to Montana was the birds, and that in DC you didn't hear them as much as, you know, obviously when you wake up on your farm. You know, what is one of the biggest differences you experienced in our nation's capital versus Montana? And again, you know, if you could talk about you know, what you appreciate about this area that keeps you coming back and keeps you here.
Yeah, Joe. So I mean, look, I'm incredibly blessed. And I think we all are living in Montana. I had a 7:40 flight this morning out of Great Falls, so I got up at 5 and walked outside at about 5:15, and the birds were singing. They were really going at it. And I said to my wife, I said, listen to that, man. I mean, listen to it. It's a beautiful thing. Birds sing here in DC too, but they never know, since the lights never go out, they never know when to go to bed. So they literally are chirping all night long. But the truth is that you know, they were going pretty strong this morning at 5. I will tell you that you know, part of what is different here, and there's a lot of differences, but the town, you know, when you're in a town, and you know, Bozeman, Great Falls, Billings, Missoula, there's kind of like this, but there's very seldom any time where if you don't listen, you don't hear a siren going off somewhere in this town where ambulances are going. Where I live, and I always tell that people come to me and say, well, you're from Montana. The Unabomber was caught in a remote area of Montana that's Lincoln, Montana. I said, well, Lincoln is remote by these standards, but if you really want to see remote, go to Big Sandy, Montana. That's really remote. But you just don't see people unless you want to see people, and that's a huge difference. It's really a 180 degree in my life that, you know, I'll be sitting, you know, on a tractor for 16 hours a day, and the only person I'll see is my wife, and then, you know, I'll see, you know, maybe 40 or 50 people walking 4 blocks to the office here. So it's urban versus rural. It's urban versus frontier, actually, and I'm just very thankful that I'm able to be able to, I guess, appreciate both, actually. I mean, they both have their advantages. If I need a carton of milk, I can walk a couple blocks, go get a carton of milk. If I'm at the farm, it's a 26-mile round trip. So, you know, advantages.
Yeah, absolutely. Well, Senator, thank you very much. We really appreciate you taking the time to talk with us today. Is there anything else that you'd like to talk to the audience about? Anything you want to mention that we haven't brought up?
Yeah, the only other thing I'd bring up is that, you know, there's been a lot of talk of another COVID package coming through, and there may be. I know the Speaker of the House is working on one. I just don't know what the right thing to do is here. I mean, I can tell you that when we went through the meltdown in 2008, when it was a worldwide financial meltdown, we put about $800 billion into the economy, and it helped pop it around. We put right at $3 trillion into it this time around, and they're talking about another trillion or two going into it, and it's all borrowed money. And I think that you do need to push money into an economy when you have economic down cycles, recessions, depressions. But what concerns me is at what point is the debt become an issue, and we may already be there, I don't know. That's the question. At what point does the debt become an issue where it becomes a boat anchor on any sort of recovery? And that's really the question. So that's my concern right now as we're moving forward.
Yeah, absolutely. Well, I think it's a tough one. That's obviously something that everybody's working on, but appreciate your thoughts about that. And thanks very much again for visiting with us today. We appreciate your time and what you're doing in DC.
Yep. Well, thank you guys. I appreciate the opportunity at any time. Okay.
That sounds good. And yeah, so Eric, I'll hand it back to you. It sounds like we're going to go to Mr. Taylor Rose. Mute.
Thank you, Senator. I appreciate it. Always great talking to you and appreciate your service. Now, one of our returning guests from Big Sky Medical Center, Taylor Rose. He joined us on our first couple episodes 8 weeks ago. It's hard to imagine that much time has flown by when this first hit Big Sky like a light switch. And so I wanted to bring Taylor back to do a little look back over the last 8 weeks, how Big Sky Medical Center has fared and thoughts on that. So Taylor, welcome back.
Thanks, Eric. I appreciate it.
So I guess let me start with that. Looking back over the last 8 weeks, what are some of the more standout moments for you or lessons learned, not only for yourself, but also for the medical center?
Yeah, it's been an interesting 8 weeks. I actually showed up to Big Sky about a week before this COVID thing hit, and just the impact and how fast it hit was just pretty astounding to me. But on the flip side, everybody who here at the hospital especially, and all the support from the community, how fast people reacted. I got multiple calls around the community from people asking just the question, what can I do? And how can I help? And just seeing the community rally up and around us together. And it wasn't just a quick bolus of support. It was this ongoing thing. And many people in the community reached out and they've supported us. And, our workforce, they canceled vacations. They canceled their personal plans to make sure they were available in case any kind of surge were to hit us. So our nurses, they were basically ready and waiting for any kind of potential big influx of patients that we were to see. So it's been impressive to me to see how much, where we started, it was something completely new. As Matt Kelley mentioned earlier, this is something that we've never seen before. We've never had to deal with this. This is a once in a lifetime kind of type pandemic that we're dealing with, but the ability for, our hospital staff and the community to rally around and really address these needs. And it's just been impressive to me so far.
Yeah. No, there was a heck of a community rally there at the beginning. I remember 8 weeks ago, we were talking about some of the efforts, like the construction crews literally showed up at your doorstep to help you guys build out a couple more rooms. Did that project get finished? Did those rooms ever get put to use?
Yeah, it's a great timing on that, because this last week we had our final construction walkthrough where we were just telling them, you missed a little paint chip there and a few things, just making sure it's all up to speed. So last week that construction project did finalize. We're just waiting to get a few occupancy permitting type things going. But if we were to get a huge influx of patients here at Big Sky Medical Center today, we'd have somewhere to put those patients now. And we'd have, those rooms fully equipped with medical gases and everything that we'd need to take care of them. I've never in my entire career seen any project happen that fast on that big of a scale. And you talk about the initial support, but I'm still seeing support. I walked into work today and I looked down at the ground, and a lot of the people in the Big Sky community, they've gone and they've done the chalk art on our patios, and just thanking the workers that work here at Big Sky Medical Center. And so it's just a continual thing. It wasn't a flashbang type thing, but this ongoing continual support has been incredible.
Yeah. Well, I guess if there's a silver lining, we certainly got the hospital even to a higher level of service and availability for if there was that surge. Where does the hospital stand in terms of operations now? I know we've kind of gone through the spectrum where, normal care was kind of pushed to the side to make priority for COVID. So talking to your audience now, I mean, I guess where do we stand with COVID and now getting back to some normal business practices? What can people expect there or services that are available?
Yeah, Big Sky Medical Center, we never turned down any service, or we didn't, stop doing any kind of service here at Big Sky Medical Center. All of the clinic was still open and running with some altered operations from the get-go. And over time, we've refined those a little bit to address the needs of COVID. And we've actually increased our services that we've been offering, partitioned them out a little bit. Right now, current operations that we have going is obviously the emergency department up and running. Our inpatient service is still up and running. Then we have the clinic that is still going and we're seeing patients. That has shifted a little bit though, to where we're trying to push a little bit more remote video kind of type visits, those telemedicine visits that you've heard about. And if you are coming in to be seen by a doctor, you'll be screened when you come in. You'll have your temperature taken. You'll be asked some questions about some of your history, potential risk for COVID. You'll be asked to wear a mask if you're on site at all. Well, not a mask, it's just a face covering. So if you are planning to visit the hospital, please do bring your own face covering. We have some available, but we're trying to conserve our personal protective equipment for, the really dire needs. But, and then we also have some visitor restrictions in place, unfortunately. We're trying to reduce the transmission of any kind of disease, especially COVID. But that basically boils down to we don't allow visitors in the hospital unless there's a pediatric patient, a child, or for some compassionate type care. So if there was somebody with some dementia or somebody with, some personal needs that they had to have somebody there with them. So there are some unfortunate side effects to this with the visitors. We are seeing all of our COVID or respiratory risk patients in what we're calling the viral triage clinic. And so if you come to the hospital and you're seen and you do screen positive for some of those questions, you'll be seen in a separate part of the facility that's got its own complete separate entrance. You're completely isolated from anybody else in the building, and you'll be taken care of in that area. We also offer drive-through COVID testing. So as the senator mentioned earlier, there is some guidelines around who can be tested, but you can always call the COVID hotline for Bozeman Health, and they can recommend you for testing if you qualify, or your doctor can write an order for your testing. And then all you have to do is drive up through our ED ambulance bay. We walk out to you. You don't even have to come into the hospital or the facility at all, and we just take care of you. We swab you, and you get your test back within about 48 hours at this point.
Okay. So there is testing if you qualify. How about antibody testing? Any talk about that, or when that might become available through your system?
Yeah, we're actively investigating that and researching it. There's a lot, and it's not just locally that we need to do more research about this. This is on a national level. We don't know the impact that the antibody testing actually has. There's so many unknowns when it comes to this, as both Matt Kelley and the senator have talked about earlier. We don't know the ability to predict somebody's immunity based on their having antibodies to COVID-19. So we're actively researching that part of it, but we are looking at the future of antibody testing and what it can do for Bozeman Health and the community that we serve.
Will Big Sky Medical play a role with, as Matt was talking about, some of the concerns around the park opening in West Yellowstone? I mean, will your facilities play a role in helping help people there, especially if some of those small communities, some of those gateway communities have some breakouts?
Absolutely. We're in active discussions with the CHP clinic that's out there, the Community Health Partners Clinic. I'm traveling out to West Yellowstone this Wednesday to talk to some of the people out there to see how Bozeman Health can support them out there. Right now, we don't know what that looks like. We are there as support. We've put up many testing sites for Bozeman Health. We have stood them up. We know what is involved and what is needed to do the testing for COVID-19. And there are a lot of smaller communities like West Yellowstone that have not been able to do that. And so we're right now lending our expertise and being, subject matter experts in the COVID-19 testing process, seeing how we can support them and help them. But we are actively in discussions with them, trying to help them out. And as Big Sky Medical Center receives about 80% of the patients coming out of West Yellowstone, we have a very large vested interest in making sure they are equipped to handle any kind of influx in patients that they would see when the park reopens.
Yeah. Well, that's good to know you guys will be playing a role there. Well, Taylor, 8 weeks later, anything else you'd like to add or any requests of the community? We asked this the first 2 times you were on, and you had some great answers, and hopefully the community listened, but any requests of the community moving forward or any needs that you guys need addressed?
Yeah, I would just say that we want people to come and be cared for if they need care. A lot of people are scared to come to hospitals because of COVID-19. They're worried that they're going to catch it because they're coming to a hospital. And I believe that there's been a stigma out in the community to stay away from the hospital. And we're seeing an increased number of visits that are due to people waiting too long to come and get care. So we would just say that we are open. We are here to serve your needs. Please come if you feel like you need to be seen. And also, Bozeman Health in general, we're restarting and reopening. We're in our next phase of the COVID-19 preparedness, and we're making sure that our employees are safe, that we're taking precautions to not overly consume our PPE supply, but we are slowly ramping back up the procedures that were considered non-essential before. And there is a backlog of that, and we're trying to catch up, and we're actively trying to support the health needs of the community. Because just because COVID's here doesn't mean we're not going to have a gallbladder that's going out. And so we need to be able to take care of those people and be able to support them. So just if you feel like you're sick, please come to the hospital, be seen, contact your physician, and we'll make sure you're taken care of.
Awesome. Well, thank you once again, and please let Dr. Hess and his great team know that we're grateful for all their hard work and everything that you've done. So thank you once again, Taylor, for joining us.
Thanks, Eric.
All righty. Now let's have a little bit of fun. We're going to try something different here. Joe has moved locations to one of our favorite restaurants right in Big Sky Town Center, live from the Rocks. Joe, take it away.
Thanks, Eric. I'm here with Carrie, Blodget, and we are at the Rocks Tasting Room and Liquor Store, Big Sky Town Center. I'm just going to show you around real quick. We've got some tables here. We've got some people eating, all 6 feet apart, which is very nice. There have been a lot of different regulations for businesses reopening. Kara, thank you for joining us. And so I wanted to ask, so the Rocks opened in Big Sky Town Center in 2018. It's a unique business. The liquor store attached to a restaurant. You and closed the restaurant to in-house Governor Bullock's directives, and you kept the liquor store open. How have the past 2 months affected you and the team here at the Rocks?
Well, we were able to stay open for to-go food also, but
Right.
at the very beginning, it was devastating.
All right. Well, we're dealing with a little bit of technical difficulty there. Hey, Blythe, why don't you come back over here? Sorry about that, everybody. We'll work on that thread and see if we can get a little better connection to go back to the Rocks. So guess what? We got a curveball coming at you, Fabozzi's. All right, we're gonna shift gears while Joe works on that connection, and bring in some other hometown heroes. Kevin and Carrie Fabozzi, they really don't need much of an introduction. If you've been around Big Sky, you've heard of this family. Down at the consignment cabin, how you guys doing down there?
We're doing good, Eric. Thanks.
Hi.
Awesome, nice clear connection there. Beautiful. Well, I guess let's jump into a softball question here. How long have you guys been in Big Sky, and what's the Big Sky community mean to you guys?
Well, you want to go first?
Well, I've been here since the summer of 1999, and the community of Big Sky to me has changed so much. It's really been incredible to watch it change. It's inspiring these days, and to me, it's all about the skiing. Sorry.
Nothing to apologize there.
Oh, man.
What about you?
Yeah, well, I moved up here in 1992 and pretty much haven't left. But, over that span of time, I still am a ski bum at heart. But there's a whole nother level of life responsibilities going on now in our lives. And as we meld, into this community, and now as it's 5 years we've owned this business together, and it changes. I'm really, I'm just really thankful for this small town. I grew up in kind of a small town where everybody kind of knew each other, and there's a lot of value there that's kind of almost untraceable to me. But but I'm a ski bum at heart too. So
Well, I think we all either want to be a ski bum or try to be a ski bum at heart. So don't ever lose that.
no.
So you touched on it a little bit. 5 years of owning the consignment cabin, and bam, we get this pivot. And one of the reasons we invited you on the show is we have the good fortune of meeting a lot of business owners around town. And I have to compliment you. The pivot that you made with taking your business live on the internet and what you've done. First off, congratulations on the pivot. Second is, it's some of the hardest I've ever laughed in the last 8 years. So talk to me about the inspiration behind this pivot.
Well, I just got to pipe up here because I feel like, I'm an artist. Carrie, and Carrie married an artist. And so I think there's some residual there. But we took it from we took a suggestion from a friend early on that maybe we ought to do something like this, and the light bulb just kind of went on and never went off. And so we finally, as it progressed, we thought we got to do this.
It can't hurt.
It can't hurt. Exactly. And we're not big volunteers in the community. We're not key players. We're at least I'm not, and I don't want to speak for Carrie, but she does a lot more in the community, I think, outwardly than I do. But I get a lot of joy of entertaining, and a lot of personal joy entertaining people. And so as a musician and as an entertainer, and Carrie as a boutique owner, we thought, and her flair with fashion and home decor and things that and we're learning as we go, we thought this couldn't hurt.
Yep.
So we just unscripted went for it.
Yeah, absolutely. Well, Carrie, you are an amazing saleswoman. I have to tell you that last week when you pulled out that Peter Pan book and started showing that, I now am the proud owner of that Peter Pan book, and I'll be giving it to my niece for her birthday party. Talk to us a little bit about your store, Carrie, kind of how you put together this incredible eclectic mix of stuff that you've got in the store, and maybe give us a pitch on something you got behind you there.
Okay. Yeah. Well, let's see. This store was actually originally here by previous owners, Dick and Janine Scheibel. And we bought it from them in 2015. So it was already here. It was already in place. But we had no idea what we were doing. All I knew was that I kind of wanted to do it. What really inspires me is markets, vintage markets, flea markets, city markets. I've always loved them. And I think that's why I got into it. And that is very much like our store today. It's very eclectic, with a ton of categories. And we have so much in this store that it's just really kind of overstimulating for a lot of people. So the online shopping has helped a lot, because I can go through and hand pick stuff that I know is a good deal and has been sitting around for a while, and maybe somebody else would like it, but they can't find it amongst the literally thousands of items that we have. So like this Shelley Lindholm art, contemporary Montana artist. This is nice production art, and it's my turn. Anyway, yeah, so we have a lot of her nice art on our wall right now, and it's produced up in Big Fork, Montana. So we really like to support other Montana businesses by bringing their product into our store, as well as used items from the community of Big Sky.
Well, you hit the word. It's eclectic, and it's beautiful in there. It's a must stop for anybody in Big Sky to go visit the consignment cabin down in the canyon. With people like the senator listening in, and the governor has been watching these, as a small business owner, what type of message do you want to pass along to the people that are calling the shots in terms of whether it's relief efforts that are needed, or legislation changes or suggestions? If you had an audience within a platform, which you do right now, what type of message would you like to pass along to the decision makers?
Well, that's a big one.
That's a big one. I can't stop thinking about leading by example. I can't expect my children to do as I do if I don't do it. And so I feel like early on, maybe there was some gray, we were all trying to adjust to social distancing and what that meant, and what that means in different spaces, and what that means to rural communities, and what that means to small towns and big cities. And so, yeah, I really do look to the leaders, the John Testers, President Trump. I'm looking to leadership, and I'm looking for them to set the example so we can follow, and be successful in curbing this pandemic.
Yeah, I would just say more solid information. I feel like nobody knows how to act or what to do, because we've gotten so many different advice, and at this point we're just learning from each other. So that helps, but it'd be nice to look to the leaders for that.
Right.
Exactly how to act and what to do moving forward. I think it's going to be kind of a tricky next 12 months.
Yeah, every town's different, every situation's different, and we can go state by state and like we're doing, but we're one big country.
Yep.
And how we act and how we play this out is really going to fall back on us.
Sure.
So I just, like I say, I think leadership, really strong leadership up front, is really important to us.
Great. Well, it's good advice. Lead by example. So what we're going to do here is we're going to jump over to the rocks, let Joe complete that interview now that he's got a little better connection. And then we're going to come back to you, Kevin, to have you play a song for us to close out the evening. But before we do that, Consignment Cabin, tell us, what's going on. You're open, appointment. Can people come down there 7 days a week? What are we looking at?
Yeah, we're open Monday through Saturday. It's off season right now, it's a little funky to open up after that big break during the off season, but we're open Monday through Saturday,
10 a.m. to 5.
10 to 5. And then we business as usual, where we accept consignment items by appointment usually. It's probably not a great time to just drop by with things. It's great to call us in advance. We're here. We're answering the phones. We're answering emails. We're definitely corresponding with our consignor base. As far as regular business hours for shopping, I think daily we're sort of adjusting our strategies to make it a really safe environment for both employees, Carrie and I, and we sometimes have help, and all our customers and consigners. So we know going into the off season, there's not a lot of foot traffic, and so I've been taking lots of mental notes on how to proceed when it does get busy, if it does get busy, you know, through the rest of the summer. So,
all right. Well, that's awesome to know that you're open. And I will tell anybody, because there are a lot of people in Big Sky right now that have kind of been refugees and they're still here. So people that are watching this, call them, go down, throw on a mask, check out that great store. And if you need a good laugh, or if you're a small business owner wanting to be inspired about how to activate your business, go onto their Facebook page and look at their archives of the past couple issues, especially the last one when these two did the margarita dance at the beginning. I'm telling you, and I'm not joking, it should be a reality TV show. You two are brilliant, amazing.
Thanks. Thank you so much, Eric.
thanks, Eric.
A+ all around. All right, Joe, back over to the rocks. Then we're going to bring it back to Kevin to play a song to close out tonight. How are you looking there, buddy?
We're good to go, Eric. Yeah, thanks for everybody's patience there. Got a little bit of technical difficulty, but we're back here with Carrie Blodget. We're here in the rocks. As I was saying before, you know, you guys opened in 2018. It's a unique business, a liquor store attached to a restaurant. Mm-hmm. You know, you and your husband, Ben, closed the restaurant to in-house dining in mid-March to comply with Governor Bullock's directives and kept the liquor store open. Mm-hmm. Tell me, you know, how have the past 2 months affected you and your team here?
Well, we kept the liquor store open, and we were also open for to-go food. But at the very beginning, when we were told that we had to shut down, it was devastating, but it was necessary, and I'm happy that the state did it because it was the appropriate thing to do. We had to, you know, all of our staff, our coworkers, as I like to say, were awesome about it. Absolutely awesome about it. We're like, okay, you know, what do we need to do? And I don't know, we've just been working. Ben and I have been working the whole time, just trying to keep the place open, and I don't know.
Yeah, no, you guys are doing a great job. You really are.
Thanks,
and I know it's been a struggle for a lot of people during a very difficult time, but you know, it's exciting to see you guys, you know, have opened up. You know, has the liquor store as an essential business allowed you to keep, you know, a more consistent, you know, revenue stream?
Definitely.
Yeah.
It's definitely been keeping a little bit of income coming in just to kind of keep our heads above water. And no, yeah, we're happy we were an essential business. That was good. That was good news when we got that for sure.
Mm-hmm. And you reopened the restaurant to in-house dining this past Monday,
Yep.
May 4th.
Yeah.
You know, albeit restricted. How has the restaurant been received to reopening?
It's been good. People have been happy to get out and have a little bit of normalcy back, which we've been happy to provide. Granted, we had to take half of our seats out, and seats at the bar no longer exist right now. But we're good. We're good. And I do want to give a shout out to Shane from the Gallatin Health Department, who came by on Monday and took a look at the place and made sure that we were doing everything okay. So, and I really appreciated him stopping in and doing that. So,
Oh, nice. No violations? Yeah. That's
no,
good to hear.
I think that maybe we were being a little bit overcautious, which is good. Made us happy.
Yeah,
but no, everybody seems to have been comfortable and good, I guess.
What's been the most challenging component to reopening a restaurant in such a strange time?
Just knowing what's right and what's not right, and making sure that we're doing everything possible, which is incredibly important to Ben and I, that we're following the rules, we're doing everything proper, we're making our guests feel comfortable. Because nobody wants to spread this. I don't want to spread it. Nobody wants to be a reason why, you know, one of my friends here in Big Sky has to go to the hospital. I think that maybe could be it.
Sure. Well, and talk a little about just that community component. What has been something that's surprised you during this time? You know, what has struck you about the Big Sky community?
No doubt about it, the generosity. The small things, the huge things, like the Big Sky Relief Fund. When I saw your interview with Lauren Val and Kevin Jermaine, blown away. Absolutely incredible. I mean, there's no words to describe it, how wonderful that is. So.
Has anything stuck out in your mind? Any small moment that you've seen, the community connecting to one another and reaching out?
Every day, everybody, and I've been mostly, in the liquor store, taking care of business in here, getting the to-go orders, but just how concerned everybody is for each other. It's just really, but that's who we are. That's who we are here in Big Sky. So we're concerned people, and we're real, and I'm fortunate to be a part of it, for sure.
And you've been a part of it for a while. How long have you been here now?
Moved up here in '94 when I was 19. So for a while, for a little bit.
For a little bit. Seen some changes.
For a little bit.
So when I walk into a restaurant now, I feel like, like I don't know what to do with my hands. Like am I too close to the bar? Can I approach a server?
Don't touch anybody.
Don't touch anybody. Don't breathe on
No.
anyone. Have you had any customers feel any sort of confusion about the methods as you reopen?
No, I don't think so. I don't think so. I think that yeah, we do need to lead by making sure that everybody sees we are washing our hands, which we did before, but we have to do it even, make more of a conscious effort to let people know that we're being sanitary and we're doing things the proper way.
Sure.
So, yeah.
Well, just a couple of final questions, Kara. Talk to me a little about the Montana theme in the Rocks.
Yeah.
Tell me a little about that.
Behind us, we have all Montana products. My husband is a 6th generation Montanan. Our kids are 7th. And when we were given the opportunity to open this place up, we just kind of went with the Montana theme. So Ben's trying to source all of his proteins and food as locally as possible. We've got, I think there's 24 distilleries in Montana. We've got 20 of them, which we have all behind the bar. We have all Montana booze behind the bar, all Montana beer. And so, yeah, and people really enjoy it. And I love talking about it, so it's good for me.
A taste of the treasure state.
Yeah, absolutely. Why not?
Why not?
Why not?
Well, last thing, what's the hottest selling thing on the menu right now? What do you got going?
Ben does an incredible pho. People seem to enjoy his pho. So.
You know how long it took me to learn how to pronounce that? I didn't know.
Me too. Everybody says it different.
Yeah.
The only one that actually pho is how Ming Sai says it. So I think it's pronounced pho. So we're going to go with that.
Right on. Yeah. Well, it is tasty. Thank you so much, Carrie. Really
Absolutely.
appreciate your time. You guys are doing a phenomenal job.
Can I say one more thing?
Yeah, please do.
I miss hugging everybody. It's killing me. I'm a hugger, but soon enough, hopefully I'll be able to hug everybody again. So anyway, that's
that's huge. And that's a big part that I think everyone's missing out right now is that human connection. But we'll get back there.
Yes.
Keep at it.
Yep.
Everyone stay strong. Eric, back to you. Thank you guys so much.
Thanks, Jeff.
All right. Well, thank you. Wonderful place. Great pho. Great progress. All right. So we're going to close it out. Don't leave yet because we waited for the best for last. Kevin is an incredibly talented artist. For those that you might have seen him this past Friday, he joined us for the FAC Club, and he's been kind enough to agree to jam a little tune for us. So we're just going to let Kevin close it out tonight. I'm grateful for our panelists. Thank you, Senator Tester, for joining us. Matt Kelley, great work. Taylor Rose, you and the team are doing great. And the team at the Rocks, we love you guys and hope to give you a hug soon. And don't forget to patronize those small businesses. Businesses are opening back up in Town Center, down in the Canyon, over in Meadow Village Center. Get out to patronize those businesses. And with that, take it away, Kev.
Hey, thanks, Eric. Thanks for having us on. Well, I was torn between, I got some suggestions from friends that heard I was going to do this. But I'll do a tune. This is, I've been doing this tune for a long time and kind of means a lot to me. It's an old Chris Hillman song and I think it's appropriate. It's called Hard Times. Tell me you love me. These days I need you more than ever before. Don't give up on me. There's nobody else here could ever love you more than I do. We all need someone. There's someone to believe in.
this life that we are sharing, built on love and trust. And if it takes a lifetime, well, I would never stop my trying to build a better life for us. High as a wild bird flies, it's wild and free, that's how I dream. Gotta keep on dreaming, 'cause we can't have what we cannot see tomorrow on the highest mountain. Out on the highest mountain, watch those wild birds fly. We could drift away, find our own blue sky. As long as you are with me, well, I would never stop dreaming. So hard times can't hold us down forever. Hard times are gonna fade away. Oh, those hard times, don't let them stop us, darling. 'Cause there will be a better day. Oh, tell me you love me. These days I need you more than ever before. Now don't give up on me. Nobody else here could ever love you more than I do. 'Cause we all need someone. Yeah, someone to believe in. This life that we are sharing, built on love and trust. And if it takes a lifetime, I would never stop my trying to build a better life for us. As a wild bird flies, it's wild and free, that's how I dream. I gotta keep on dreaming. 'Cause we can't have what we cannot see tomorrow on the highest mountain. Out on the highest mountain, we could watch those wild birds fly. We could drift away, find our own blue sky. As long as you can with me, never stop dreaming. 'Cause hard times can't hold us down forever. 'Cause hard times are gonna fade away. Hard times, don't let them stop us, darling. 'Cause there will be a better day. There will be a better day. Tell me you love me. These days I need you more than ever before. So don't give up on me.